Hey everyone, this is day 4 post-op. We're having the surgery on Wednesday, and I had a ulnar shortening osteotomy, also with a arthroscopic debridement and repair from a TFCC tear, which that doesn't seem like it was too complicated. More so this ulnar shortening because this is kind of what caused that. Long story short, I don't think I went into this in my last video, but my ulna bone in my left arm was longer than average, and basically due to that and through time, it started to basically rub against the cartilage, basically tearing it and making no more cushion in between that and the other bone nearby, so causing a lot of pain whenever the wrist bends or twists, the torsion of it. So this I've gone through several remedies since last May, and this was basically the end resort. And also knowing I'd have to get this done in the long end, I chose to do this. And unfortunately, like I said before, it's going to be a lengthy recovery. So right now, day 4. I'm kind of coherent right now because I've been up on the meds pretty good, and I've been eating some lunch now. Still in bed for the most part, but I'll get up and walk around. But even when I'm wearing a sling, there's a lot of pressure on the surgery site, so it's hard to walk around when there's no support underneath it other than like a soft cushion, which is what I'm using right now. I got this nifty thing. They recommend it off of Amazon, kind of like a little triangular cushion, and it's really helpful to rest my arm on it. It does help to keep my arm elevated like this, but obviously I can't keep it like that all day, and this reminds me of the kid rookie of the year, so no, I'm not getting my fast pitches down any faster doing this. So yeah, there's some support, but for the most part there's a lot of discomfort still when the pain meds wear off. It hurts a lot, a lot. I've described it as a C-section underneath my arm, for those of you who had C-sections before. And basically, right underneath the forearm there is where there's a long incision down. And once this is off, I think they'll be able to show me that before they cast it, which should be in less than a week. I'm hoping to maybe get an appointment in sooner, but it's for Friday. And once the cast is on, there'll be a little bit more of a comfort level. Like I could see where I'm at with trying to drive or just be able to use it a little bit more since it's not just in a surgical band-aid right now. You could see based on the other day, I'm able to move my fingers a lot more. I'm still not supposed to grip anything, but I could almost strain them all the way. That's fine, although there's some tension. Like basically, as you strain it, there's tension going down the arm for where that incision site is. The thumb isn't too bad, but I basically have to keep up with kind of moving them like any sort of surgery, and kind of wiggling a little bit. But this is definitely a lot better than it was 2 days ago, where I felt like I couldn't even strain it from here. So I could, for the most part, get up all the way, although there's a little bit of pain. So that's good. Being as active as I am, it's really hard not to try to grab on anything or use it in any way, even though I could use my fingers, because doing anything with this can tear open that incision site, which we don't want to do, and as well as ruin the healing of the bone placement. So what they ended up doing was they had to cut the bone, the ulnar bone in my forearm, and take out, there's like a little tool they use, but take out a slice of the bone about 4 millimeters, and they leave that space there, but what they use to try to fuse those bones back together to make it shorter is a plate, as well as some nails. Hoping to see the x-rays when I go in, and hopefully be able to show that to you guys. But there is about, I think there was maybe 4 to 6 screws in my arm, which is weird to think about because they're like screws you would drill into a wall. So yeah, so it's starting to get a little uncomfortable, and I think looser based on wearing this for a couple days, because I can move it a little bit more even though I'm not supposed to. And it's definitely, just like wearing a cast, kind of itchy in various places, and you're not supposed to do anything with that. So yeah, day 4, and just trying to rest still, keep it immobile, but at the same time trying to move the fingers around a lot more, and stay up on the meds. I'm still not off of the opioids or the painkillers, switching to like Tylenol or ibuprofen yet. Um, Hopefully another day or so. But like I said, any pressure that's down onto the bottom of my arm, even if my arm's just like hanging here off the, because it's like kind of pushing into the um, material that it's in, it does have some pain there. So that's that. That's my update for today. And I'll probably update another day or two, and then especially once I get this off and see the doctor for my post-op. Some people have asked how long I'll have this on. Well, this will come off after my post-op follow-up with the doctor, the surgeon. But then what they'll do is they'll take an X-ray, see where it's at healing-wise, and they will cast it then. So as of right now, the cast will be about the same size for about 3 to 4 weeks. And they'll do the same thing when we see them again, take it off, X-ray, and hopefully put a smaller cast on. So I'll be casted even longer, probably for a total of 8 weeks. But depending on how it's healing, it'll either be another cast this big or one just on the forearm, which of course would be ideal because then you can move your elbow a little bit more and whatnot. So, and then I don't start PT until a cast is all the way off. So it's again a little bit of a journey. It's gonna be difficult with the 1-year-old. Colby wants me to lift her all the time, and even the boys. I feel bad because they're on their holiday break right now, and we can't really do anything too exciting because mom's in bed. But I guess this is one of those things. Get it done sooner than later, and hopefully it helps fix the pain and give me some relief that I've been having for several months, and the lack of strength I started to lose in my wrist because of this. So, yep, fun times. All right, thank you guys, and I'll see you later. Thanks for all the good wishes. Bye.